Today we're diving into a topic that's crucial for men's health, but often overlooked or discussed with a lot of awkward. Penile health.
Oh, absolutely. It's one of those areas where there's so much misinformation out there, and men often feel uncomfortable asking questions. I think it's fantastic that we're tackling this head on, making it accessible and, dare I say, even a little fun. We're going to be discussing 10 things you should never do to your penis based on some really insightful information from a urologist. It's all about taking care of a very important part of the male anatomy.
Exactly, and it's not just about sexual function, as we'll see. Penile health is a significant indicator of overall well-being. So let's jump right into the first point, which is perhaps the most fundamental. Don't ignore your penis. The document we're referencing highlights that your penis functions as a barometer of your overall health. It's often called the canary in the coal mine, especially when it comes to cardiovascular health.
The canary in the coal mine analogy is so powerful, David. Can you elaborate on that? What's the direct link between, say, erectile dysfunction and something as serious as a heart attack?
It's a critical connection, Emily. The document states that when men start having trouble with erections and are followed for 7 years after the onset of their problems, a significant 14% go on to have a heart attack. This isn't a coincidence. The blood vessels that supply the penis are much smaller than those that supply the heart. So if there's any narrowing or hardening of the arteries, a condition called atherosclerosis, it often manifests in the smaller penile arteries first, long before it affects the larger coronary artery. Think of it like a plumbing system. The smallest pipes get clogged first. This endothelial dysfunction, where the lining of the blood vessels doesn't function properly, is a precursor to broader cardiovascular disease. So erectile dysfunction isn't just a sexual issue. It's a warning sign that your circulatory system might be in trouble.
Wow, that's a really clear explanation. So it's not just about getting an erection, but what that erection signifies about your internal health. The document also mentions that good, strong erections tell you a lot about your body. Good blood flow, hormones functioning well, a properly working nervous system, being psychologically in a good place, and not taking harmful substances. That's a comprehensive health report right there.
It truly is. Let's break those down a bit. Good blood flow directly relates to what we just discussed about cardiovascular health. If your arteries are healthy and flexible, blood can flow freely, which is essential for an erection. Hormones functioning well primarily refers to testosterone. Low testosterone can impact libido and erectile quality. Your nervous system working properly is crucial because erections are initiated by nerve signals from the brain and spinal cord. Conditions like diabetes or neurological disorders can damage these nerves, and psychologically in a good place is huge. Stress, anxiety, depression, and performance pressure can all inhibit erection. Finally, not taking substances that might affect penile health covers everything from excessive alcohol and recreational drugs to certain prescription medications that can have ED as a side effect. It's a holistic picture.
That makes so much sense. So if a man starts experiencing ED, it's not just a personal problem, it's a signal to get a full health checkup. It's like your body is sending you a very direct, albeit sometimes embarrassing message. What's an actionable takeaway for our listeners on this point, David?
The most important actionable takeaway is, if you're experiencing erectile dysfunction, don't ignore it and don't be embarrassed. Talk to your primary care physician. They can run tests to check your cardiovascular health, hormone levels, and overall well-being. It's an opportunity for early detection of potentially serious underlying condition. Think of it as your body giving you a heads up, and you should absolutely listen. Building on this concept, I've seen patients come in for ED, and after a thorough workup, we've uncovered undiagnosed hypertension or even prediabetes. Addressing these issues early can literally save lives, not just improve sexual function.
That's incredibly valuable advice. Moving on to our second point, and this one sounds like it could lead to some real horror stories. Don't DIY things for your penis. The document explicitly states there's no at-home remedy that will safely make your penis longer or thicker, despite what ads might promise. And it mentions some truly dangerous practices like jelqing and homemade constriction bands. I'm already wincing.
You should be wincing, Emily, because these practices are incredibly dangerous and, frankly, ineffective. Let's start with jelqing. This involves using hand pressure to stretch the penis, often with the belief that it will increase length or girth. The problem is, the penis is not like a muscle you can stretch and grow. It's made of erectile tissue encased in a tough, fibrous sheath called the tunica albuginea. When you apply excessive pressure, you're not safely stretching tissue. You're causing microtraumas, tiny fractures in tunica albuginea. Over time, this leads to scar tissue formation, which can actually shorten the penis, cause curvature, and most commonly lead to irreversible erectile dysfunction. Urologists regularly see young men who have caused permanent damage to themselves through excessive jelqing, and it's heartbreaking because it's entirely preventable.
Irreversible damage? That's terrifying. And it's all based on a myth that you can somehow grow your penis at home. Why do you think these myths persist so strongly despite all the medical evidence against them?
It's a combination of factors, Emily. There's a lot of societal pressure and anxiety around penis size, fueled by media and sometimes by unrealistic expectations. This creates a vulnerable market for unscrupulous advertisers who promise quick fixes. People are often desperate for a solution and fall prey to these claims. From a broader perspective, it highlights the danger of seeking medical advice from unverified sources online rather than consulting qualified healthcare professionals. As for homemade constriction bands, the document gives a vivid example of a patient needing a jigsaw from the fire department to remove a construction nut. This isn't just uncomfortable, it's a medical emergency. These objects can cut off blood flow, leading to severe swelling, tissue damage, and even gangrene if not removed promptly. The solution, as the document points out, is simple. If you need a constriction band for erectile support, buy a proper one for about $20. They're designed to be safe and easily removable.
A jigsaw from the fire department? That's a story you tell your grandkids, but probably not in a good way. It really underscores the point about not improvising with something so delicate. So for anyone listening who might be concerned about penis size, what are the safe medical options, if any? Or is it mostly about managing expectations?
That's an excellent question. For most men, concerns about penis size are often rooted in perception rather than reality. Studies show that most men overestimate the average penis size and underestimate their own. Medically, there are very few safe and effective options for increasing size. Surgical procedures like suspensory ligament release can add a small amount of visible length by releasing the ligament that anchors the penis to the pubic bone, but it doesn't actually make the penis longer. Just more of it is external. These procedures come with risks, including scarring, altered sensation, and potential impact on erectile function. Fat injections for girth are also risky, often leading to uneven results, lumps, and absorption over time. My advice is always to consult a urologist. We can discuss realistic expectations, address any underlying body image issues, and rule out any actual medical condition. Often, simply understanding the normal range and focusing on overall sexual health and confidence is far more beneficial than chasing an elusive ideal size through dangerous means. The actionable takeaway here is clear. If you have concerns about your penis, talk to a doctor, not an internet forum or a shady ad.
Solid advice, David. It's always better to trust the expert. Let's move on to point number 3, keep it clean. This seems pretty straightforward, but the document highlights a specific area that men with foreskins sometimes forget. Pulling it back to clean underneath. This can lead to balanitis or foreskin infections, which sound incredibly uncomfortable.
It is straightforward but often overlooked. Balanitis is indeed very uncomfortable, causing redness, swelling, itching, and discharge. It's essentially an inflammation of the glands, head of the penis, and foreskin. The main culprit is smegma, a cheesy-like substance made up of dead skin cells, oils, and moisture that can accumulate under the foreskin if not cleaned regularly. This creates a perfect breeding ground for bacteria and fungi. So yes, the advice is simple. Always pull back your foreskin, clean underneath with warm water, and dry properly. If you can't pull it back, that's a problem called phimosis. The document mentions that while penile cancer is extremely rare, it can develop under the foreskin where you can't see it. This is a serious concern. If you have phimosis, you absolutely need to talk to your doctor. Sometimes it can be addressed with steroid creams or stretching devices, but in some cases, circumcision might be recommended to prevent recurrent infections or to allow for proper hygiene and cancer screening.
So it's not just about comfort, but also about preventing potentially serious health issues like cancer. And what about the type of cleaning? The document warns against aggressive cleaning with strong scented soaps that can cause irritation. What's the best approach there?
The skin on the penis is very sensitive, Emily. Strong scented soaps, harsh detergents, or aggressive scrubbing can strip away natural oils, disrupt the skin's pH balance, and cause irritation, dryness, or even allergic reaction. The best approach is gentle. Let soapy water run through during your shower. Ensure there's no smegma buildup, but don't scrub aggressively. A mild, unscented soap or just plain warm water is usually sufficient. Think of it like cleaning a delicate instrument. You want to be thorough but gentle. From a broader perspective, good hygiene is a cornerstone of preventative health, not just for the penis, but for the entire body. It reduces the risk of infections, skin irritations, and can even contribute to a better sense of self-care and confidence.
That's a great analogy, David. Gentle but thorough. Our fourth point is a really important one, and it ties into what we discussed about not ignoring your penis. Don't ignore pain or warning signs. The document stresses that if you notice a problem, talk to your doctor. It lists potential issues like STIs, UTIs, blood in urine, and ulcers, which could signal something as serious as penile cancer. I know it can be incredibly difficult for men to show their genitals to a doctor and feel vulnerable, but as the document says, your health is worth it.
Absolutely, Emily. This is where the psychological barrier often comes into play. Men are often conditioned to be stoic, to tough it out, and there's a lot of shame or embarrassment associated with genital issues. But ignoring symptoms is the worst thing you can do. Let's elaborate on some of those warning signs. Sexually transmitted infections, or STIs, can manifest as sores, warts, discharge, or painful urination. Early detection and treatment are crucial to prevent long-term complications and further transmission. Urinary tract infections, while more common in women, can affect men too, causing pain, frequent urination, or blood in the urine. Blood in the urine, or hematuria, is a red flag that should never be ignored. It could be something benign like a kidney stone, but it could also signal bladder stones or, more seriously, kidney or bladder cancer. And then there are ulcers on the penis. The document highlights that the saddest cases involve men who ignored ulcers that turned out to be penile cancer. While extremely rare, penile cancer is aggressive. Addressing problems early means less invasive treatment, potentially saving the penis and even the man's life. I've personally seen cases where a small, seemingly innocuous lesion was ignored for months, only to become a much larger, more complex cancer requiring extensive surgery. It's a stark reminder that early intervention is key.
That's a powerful and sobering thought, David. It really emphasizes the importance of overcoming that initial discomfort. What advice do you have for men who feel judged by a doctor, as the document mentions? Because that's a real concern that can deter people from seeking help.
That's a completely valid concern, Emily. No one should feel judged by their healthcare provider, especially when discussing something so personal. If you feel judged, find another doctor. It's that simple. You deserve a doctor who is empathetic, professional, and makes you feel comfortable. A good doctor understands the vulnerability involved and focuses solely on your health. From a broader perspective, this speaks to the importance of patient advocacy. You have the right to a doctor who listens and respects you. For actionable takeaways, I'd say regular self-examination is important. Get to know what your penis normally looks and feels like. If you notice any persistent changes, a new lump, a sore that doesn't heal, unusual discharge, or any pain, don't hesitate. Make an appointment. Your health is paramount.
Excellent advice. Self-advocacy is so important in healthcare. Let's move on to point number 5. Stay in control and be safe. The document starts by saying there's nothing hotter than safe sex, which I absolutely agree with. It talks about prioritizing safety with condoms to avoid STDs or pregnancy, allowing for uninhibited sex. But then it gets into something quite alarming: penile fractures. I didn't even know that was a thing until I read this.
It's definitely a thing, Emily, and it's a surgical emergency. A penile fracture occurs when an erect penis bends forcefully, often during sex, causing a tear in the tunica albuginea, that fibrous sheath we talked about earlier that surrounds the erectile tissue. It's not a bone fracture, but it's a serious injury. The document describes the classic signs: a popping sound, significant pain, and the penis becoming very swollen and discolored, often described as looking like an eggplant. This happens because blood leaks out of the torn erectile tissue and pools under the skin. If this happens, you need to go to the emergency room immediately. If left unrepaired, about half of men will develop erectile dysfunction, and there can be permanent curvature or scarring. The surgery involves repairing the tear in the tunica albuginea. Recovery can take several weeks, and it's a painful experience.
A popping sound and an eggplant-like appearance? That's incredibly vivid and sounds absolutely terrifying. What are the common scenarios or positions where this is more likely to to happen, and how can people prevent it?
It often happens in positions where the woman is on top or during doggy style, where there's less control over the angle and force, and the penis can accidentally hit the pubic bone or perineum. The key to prevention, as the document states, is to maintain control during sex. This means being mindful of the angle and speed, and if you're in a position where control is difficult, like the woman on top, the man can hold his partner's hips to guide and control the movement. Communication with your partner is also crucial. If something feels off or painful, stop. And this leads us to another important aspect of safe and enjoyable sex: lubricant. The document emphasizes using lubricant, not just for comfort, but to reduce friction and prevent injury. It also makes a great point: don't feel like there's something wrong with your partner if natural lubrication is insufficient. This is normal with aging, medications, or other factors, and doesn't mean they aren't aroused. It's just a practical tool to enhance pleasure and safety for everyone involved.
That's such an important point about lubricant, David. It's not a sign of a problem, it's a tool for better, safer sex. It's like using oil in an engine, it just makes everything run smoother. So, actionable takeaway here: prioritize safe sex practices, communicate with your partner, and don't be shy about using lubricant. And if you hear a pop and see an eggplant, get to the ER immediately.
Exactly. Moving on to point number 6, don't make it hot. This one focuses on testicular health, specifically keeping your testicles in a relatively cool environment. The document explains that testicles hang outside the male body because they need a specific temperature to produce sperm, and excessive heat exposure can affect sperm production and potentially testosterone levels.
This is fascinating, David. So there's a very specific biological reason why testicles are external. What's the optimal temperature range, and how significantly can heat impact sperm production and testosterone?
The optimal temperature for spermatogenesis, which is sperm production, is actually a few degrees cooler than core body temperature, typically around 93-95 degrees Fahrenheit, 34-35 degrees Celsius. That's why the scrotum acts as a natural thermoregulator, contracting when it's cold to bring the testicles closer to the body for warmth, and relaxing when it's warm to allow them to hang further away and cool down. Excessive heat can significantly impair sperm motility, reduce sperm count, and even affect the morphology, shape, of sperm, all of which can impact male fertility. While the effect on testosterone levels is generally less pronounced than on sperm production, chronic exposure to high temperatures can potentially have an impact. The document gives practical examples. Limiting exposure to hot tubs, jacuzzis, and steam room. These environments can raise scrotal temperature significantly. Also, placing a laptop directly on your lap or keeping your phone in your front pocket can generate enough heat to be detrimental. The heat from these devices, even if subtle, can contribute to a warmer scrotal environment over time. From a broader perspective, this is a key consideration for male fertility, especially for couples trying to conceive. Simple lifestyle changes can make a big difference.
That's really insightful. So it's not just about comfort, but about maintaining fertility and potentially hormonal balance. How much heat is too much? And are there specific types of underwear that are better or worse for this?
It's not about a single instance of heat exposure, but rather chronic or prolonged exposure. So an occasional hot tub dip is probably fine, but daily use might be problematic if you're concerned about fertility. As for underwear, the traditional advice has been that boxers are better than briefs because they allow for more air circulation and keep the testicles cooler. While some studies have shown a slight difference, the impact is generally considered minor compared to more significant heat sources like hot tubs or prolonged laptop. The actionable takeaway here is to be mindful of your environment. If you're using a laptop, put a cushion or a lap desk between it and your body. Keep your phone in your back pocket or on a desk. And if you're trying to conceive, definitely limit your time in hot tubs and saunas. It's about making small, conscious choices to protect your reproductive health.
Small changes, big impact. That's a theme we often come back to. Let's move on to point number 7. Be nice to it. This one talks about masturbation and avoiding what's called a death grip, which can create sensations that can't be replicated by a partner's body, potentially leading to difficulty getting aroused or maintaining erections during partnered sex. This is a really interesting psychological and physiological point.
It's a very common issue, Emily, and it's often not discussed. The death grip refers to masturbating with a very strong, tight grip, often combined with a specific, intense rhythm or pressure. Over time, the body can become habituated to this very specific, high level of stimulation. When a man then tries to engage in partnered sex, the natural sensations provided by a partner's body, which are typically softer, more varied, and less intense, might not be enough to achieve or maintain an erection. It's a form of desensitization. The brain and penis have learned to expect a certain type of stimulation, and anything less can feel unsatisfying or insufficient. This can lead to performance anxiety, frustration, and a vicious cycle of self-doubt, impacting intimacy and relationship. The document advises trying to masturbate in ways similar to how you'd be aroused with a partner, using lubricant and enjoying pleasure rather than making it a shameful, rushed experience. This is about fostering a healthy, positive relationship with one's own sexuality.
That makes so much sense. It's like training your body for a very specific, almost extreme type of stimulation, and then expecting it to perform the same way with a different, more nuanced input. So, what are some alternative masturbation techniques or ways to resensitize if someone realizes they've fallen into this death grip habit?
The key is to vary the stimulation. Instead of a tight grip, try using a looser hand or even a flat hand. Experiment with different textures like a soft cloth or a sex toy designed for gentler stimulation. Use plenty of lubricant to reduce friction and allow for a smoother, less aggressive touch. Focus on pleasure and sensation rather than just achieving orgasm as quickly as possible. It's about retraining your body and mind to appreciate a wider range of sensation. For resensitization, it might involve taking a break from masturbation for a period or consciously practicing gentler technique. It's also important to address any underlying performance anxiety or unrealistic expectations about sex. From a broader perspective, this highlights the importance of healthy sexual development and understanding that sex, whether solo or partnered, is about connection, pleasure, and intimacy, not just intense physical sensation. The actionable takeaway is to explore and experiment with different masturbation techniques, use lubricant, and focus on pleasure and connection rather than just intense pressure. Be kind to yourself and your body.
Being kind to yourself, that's a theme that keeps coming up, and it's so important. Let's move on to point number 8. Don't smoke and take care of your health. The document is very direct here. Smoking will absolutely kill your erections and cause erectile dysfunction. It also mentions higher rates of bladder cancer in smokers. This really brings us back to the holistic view of health we started with.
It absolutely does, Emily. Smoking is one of the most detrimental habits for overall health, and penile health is no exception. The physiological effects are clear. Nicotine is a vasoconstrictor, meaning it narrows blood vessels, reducing blood flow. Over time, the chemicals in cigarette smoke damage the endothelial lining of the blood vessel, leading to atherosclerosis and impaired nitric oxide production, which is essential for vasodilation and achieving an erection. So yes, smoking directly contributes to erectile dysfunction. It's not a matter of if, but when and how severely. Beyond ED, the document highlights bladder cancer. Smokers are at a significantly higher risk because the carcinogens in tobacco smoke are absorbed into the bloodstream, filtered by the kidneys, and then accumulate in the bladder, where they can damage the cells lining the bladder, leading to cancer. Bladder cancer is indeed one of the worst cancers, often requiring extensive monitoring and potentially life-changing surgeries, like a cystectomy, where the bladder is removed. This point really underscores that your overall lifestyle matters tremendously for penile health. The document lists a healthy diet, avoiding excessive drug or alcohol use, regular exercise, and minimizing chronic stress as crucial for maintaining healthy erections.
That's a powerful reminder of the far-reaching consequences of smoking. It's not just lungs and heart, but also erections and bladder. You mentioned a healthy diet, exercise, and stress reduction. Can you quickly elaborate on how each of those specifically impacts penile health beyond just general well-being?
Certainly, a healthy diet rich in fruits, vegetables, whole grains, and lean proteins supports cardiovascular health, which, as we discussed, is directly linked to erectile function. It helps maintain healthy blood pressure, cholesterol levels, and prevents obesity, all factors in ED. Regular exercise, particularly aerobic exercise, improves blood flow throughout the body, including to the penis. Resistance training can also help boost testosterone levels, which contributes to libido and erectile quality. Minimizing chronic stress is vital because stress triggers the release of cortisol and adrenaline, which can constrict blood vessels and divert blood flow away from non-essential functions, like erection. Chronic stress also impacts sex drive and can lead to performance anxiety. The document recommends the book Atomic Habits for making positive lifestyle changes, and I second that. It's about taking baby steps, making changes so simple you can't ignore them, and building momentum. For example, if you want to exercise more, start with a 5-minute walk every day. If you want to eat healthier, swap one unhealthy snack for a piece of fruit. These small small, consistent actions accumulate into significant health benefits over time, including for your penile health.
I love Atomic Habits. It's all about making those tiny, consistent efforts. So, actionable takeaway: quit smoking, adopt a healthy lifestyle with diet and exercise, and find effective ways to manage stress. These aren't just good for your general health, but specifically for your erections and long-term penile well-being. Let's move to point number 9, which ties into the mental health aspect. Be nice to yourself. The document states that men with penile issues are often extremely hard on themselves, creating a vicious cycle of stress, performance anxiety, and difficulty.
This point is incredibly important, Emily, and it's often overlooked in the clinical setting. The psychological impact of penile issues, especially erectile dysfunction, can be devastating for men. There's a huge amount of pressure, both internal and external, to perform sexually. When a man experiences an occasional issue, his mind immediately jumps to worst-case scenarios. He might think, what if it happens again? Or am I less of a man? This anxiety then becomes a self-fulfilling prophecy. The stress and fear of failure actually make it harder to get an erection the next time, creating a vicious cycle. This performance anxiety is a real physiological inhibitor. The brain, sensing stress, releases chemicals that constrict blood vessels and prevent the relaxation needed for an erection. The document rightly points out that everyone experiences fluctuations in penile function. Occasional issues are normal. They don't mean your life is over or that there's something fundamentally wrong with you. Unfortunately, men rarely talk about these issues, which only makes the stress worse because they feel isolated and ashamed. This silence perpetuates the problem.
That's so true. The stigma around men's mental health, especially concerning sexual function, is immense. How can partners support men dealing with these issues, and what resources are available for men to break this cycle of self-criticism and anxiety?
Partners play a crucial role, Emily. The most important thing a partner can do is offer understanding, reassurance, and non-judgmental support. Avoid making it about yourself or expressing disappointment. Instead, focus on intimacy, connection, and open communication. Reassure your partner that their worth isn't tied to their erectile function. Explore other forms of intimacy and pleasure that don't rely on penetrative sex. For men, breaking the cycle starts with acknowledging that it's okay to have these issues and that they are common. Seeking professional help, such as therapy or counseling, can be incredibly beneficial. A therapist can help address performance anxiety, body image issues, and communication challenges. Support groups, though less common for this specific issue, can also provide a sense of community and shared experience. From a broader perspective, we need to destigmatize men's health issues and encourage open conversation. The actionable takeaway here is to practice self-compassion. Understand that fluctuations are normal. If issues persist, seek professional help. A urologist can rule out physical causes, and a therapist can address the psychological component. And most importantly, talk about it, whether with a trusted friend, partner, or professional. You are not alone.
That's a powerful message, David. You are not alone. And finally, our 10th point, which is a classic saying, use it or lose it. The document asks if there's truth to this and says, sort of. It talks about nocturnal erections and the importance of oxygenated blood flow, and how a lack of use can lead to shortening or scar tissue. This sounds quite serious.
It is serious, Emily, and it's a concept known as penile rehabilitation in the medical community. The use it or lose it principle here primarily refers to nocturnal penile tumescence, or NPT. Normally, men have 3-5 erections during sleep, often during REM cycles. These nocturnal erections are your body's natural way of protecting your penis by ensuring good oxygenated blood flow to the erectile tissue. This regular influx of oxygenated blood helps maintain the health and elasticity of the smooth muscle cells within the penis. Without these regular tune-ups, the tissue can become deoxygenated, leading to fibrosis, the formation of scar tissue. This scar tissue can cause the penis to become shorter, less elastic, and the tissue might feel different. This is particularly relevant for men who stop having sex due to ED, embarrassment, or a partner's disinterest, and consequently also stop having nocturnal erections. We see this often in men after prostatectomy, where nerve damage can temporarily or permanently impair erection. In these cases, we often recommend penile rehabilitation, which can involve medications or vacuum vacuum erection devices to encourage blood flow and prevent tissue damage. The document also mentions that if sex drive decreases and you avoid sex for a period, your body may realize it doesn't need it anymore, further decreasing your drive. While this might not concern everyone, it can be problematic in relationships, as intimacy is a vital component.
So these nocturnal erections are essentially a natural maintenance system for the penis. What if someone isn't having them? Is there a way to know, and are there ways to stimulate them or compensate for their absence?
That's a great question. Most men aren't consciously aware of their nocturnal erections, but if you wake up with an erection, that's a good sign. If you consistently don't, it might be worth discussing with a urologist. They can perform tests like a nocturnal penile tumescence study to monitor for erections during sleep. If NPT is absent or significantly reduced, it often points to a physical cause for ED rather than a purely psychological one. To compensate, or as part of penile rehabilitation, doctors might prescribe daily low-dose PDE5 inhibitors like Cialis to encourage blood flow, or recommend a vacuum erection device, VED, to manually induce erections and stretch the tissue, preventing fibrosis. The document also touches on the broader benefits of sex and intimacy with a partner at any age. It's not just about physical function, it's about connection, emotional well-being, and maintaining a healthy relationship. Not everyone wants sex all the time, but there's tremendous value in intimacy, whether it's physical touch, emotional closeness, or shared experiences. It's about making an effort, both individually and as a couple, to nurture that connection.
That's a beautiful way to put it, David. Intimacy is so much more than just sex. So the actionable takeaway here is to be aware of your body's natural maintenance system, discuss any concerns about nocturnal erections with a doctor, and actively work to maintain intimacy and sexual health throughout life in whatever form that takes for you and your partner.
Absolutely, Emily. And that brings us to the end of our 10 crucial points. What a comprehensive discussion we've had today. We've covered everything from the penis as a barometer of overall health to the importance of self-care and intimacy. The main takeaways are clear. Your penile health is intrinsically linked to your overall health. Don't ignore warning signs, whether they're about erections, pain, or unusual changes. Seek professional medical advice rather than resorting to dangerous DIY remedies. Prioritize hygiene and safe sexual practices. Be mindful of environmental factors like heat, and understand the impact of lifestyle choices like smoking. And perhaps most importantly, be kind to yourself, communicate openly, and remember that fluctuations are normal. Maintaining an active and intimate life, in whatever form that takes, is beneficial for both physical and emotional well-being.
Couldn't agree more, David. This has been an incredibly informative and, I hope, empowering conversation for our listeners. The actionable insights are plentiful. Get regular checkup, talk to your doctor about any concerns, practice safe sex, maintain a healthy lifestyle, and foster open communication with your partner and yourself. It's about taking proactive steps to ensure not just penile health, but holistic well-being. For anyone who wants to dive deeper, I highly recommend reviewing the original document that inspired today's discussion. It's packed with valuable information.
Indeed, and remember, as the document concludes, take care of yourself because you are worth it. Your health, including your penile health, is an investment. Thank you for joining us on the Health Hub today. We hope this discussion has provided you with valuable insights and encouraged you to prioritize this often overlooked aspect of men's health.
Thanks for tuning in, everyone. We'll catch you next time on the Health Hub. Stay healthy, stay happy.